How much is known of the synergism of chemicals? Should people monitor which chemicals they use together and mix?
This is a difficult question. Synergism isn't really it's difficult. Normally, the studies, the toxicological studies, are done for a single compound with the animals. But in the environment, we have a lot of chemicals, and therefore we have for some chemicals we have these synergism. Synergism. This means, for example, 2 and 2 is not 4. 2 and 2 is more than 4. So in synergism, and sometimes it can be a good thing. For example, if you work in a business and you work in a teamwork, and then the result for synergism would be better than each one will do it alone. But for chemicals, for some chemicals, it's dangerous if we have 2 chemicals, and then the result will be more toxic than only from the if you have only 1 chemical.
There are now chemicals that are forbidden to use, but still maybe need to be used. DDT is a good example, and it still can be used in developing countries to fight malaria. But are there better and safer alternatives to DDT?
The use of DDT is banned according to the Stockholm Convention. But in some countries, especially in the tropical countries, they use DDT, or it's allowed to use DDT. There are alternatives for DDT. This means there are different pesticides, but these pesticides are more expensive and more toxic, and these chemicals are not so effective. There are also some other alternatives. They can use some environmental management. For example, if you know where these mosquitoes larvae are, these are in lakes, and then you can destroy these lakes, or you can clean these lakes from dead vegetables, and then this is an alternative to chemicals. You can use this environmental management process, or you can use some protective clothes, or you can use some biological methods. But it depends for this case from area to area. It's different. There's not the best alternative to DDT. In some cases you have to use DDT still.
Now a bit more personal questions. How much do you monitor the different kinds of chemicals in the products you buy, and how does this affect your shopping?
If I buy some products, for example, a refrigerator, and then I see this eco label, and then I see there are different classes for the energy, class A, class B, class C, and so on. And then I look for products which has the best energy efficiency, and then I will buy this. This is a little bit more expensive, but it's better for the environment, and I will buy these products. Or for example, if I go to the market and if I buy, for example, strawberries, I can buy strawberries all over the year, but I know strawberries are produced in regions where the climate is not so optimal for these strawberries, and therefore the other countries, they have to use pesticides, and therefore if I buy strawberries out from the normal season in Europe, and then I know they have a lot of pesticides. Therefore, I eat only strawberries in May and in June.
Are there certain medications that you do not use because of the effects of the environment they have?
No. If I'm really ill, and then I need, I use these pharmaceutical drugs. But if I have only, let's say, fever, and then I will stay at home, and I don't need any medication. But if I'm really ill, then I take also these pharmaceuticals. Maybe some of these pharmaceuticals are not so good for the environment.
So basically what you're saying is people just need to look at their habits and only use things they need, and in moderate quantities.
Yes, what is for pharmaceuticals?
No, for everything, you know, people maybe don't need to buy so many strawberries in the winter and so many.
Yes, therefore we need also some communication, and we have to say if they buy these food not in the high season here in Europe, and then they have to know that these products are contaminated with pesticides. We have a better information for these people, and therefore we need really this communication also between the industry and the population, and communication between the government and the population. Therefore, we need a lot of information and communication, and then we can maybe reduce a little bit the risk for the human health, and also risk for the environment.
Okay, thank you.